Welcome to the BOOMCLAP podcast, where culture and conviction collide. I'm Rita Rogers.
And I'm Cecily Dickey.
Today, we've got a great episode for you. Before we get into that, though, I just want to ask you, if you haven't yet, please go and leave us a review. Leave us a 5-star if you listen on Spotify. If you listen on Apple, 5-star with a written review is amazing. We really appreciate those, and those help propel our podcast to new listeners. It's really the only active way we have to help our podcast get to new ears. So if you haven't yet, or if you have a long time ago, please go leave us a new one. We really, really appreciate it. Okay, so today our episode is with Joel Gator Warsh. He is a practicing board-certified pediatrician and an expert in integrative medicine. He encourages parents and caregivers to ask questions while simultaneously reconciling the often intimidating divide between traditional and alternative health and parenting philosophies. He recently wrote a book, Parenting at Your Child's Pace, which we talk a little bit, especially towards the end of the episode about, but it's much needed guidance on the first 3 years of life.
Yeah, which I was saying to Rita that book, I think would be a great resource for brand new parents, like to give at a baby shower, or even like if you find out a friend or a family member is pregnant, a great way to congratulate them would be to gift them this book, because it definitely sounds like the kind of resource that you would want at that time of your life.
Yeah, I will say, like, neither Cecily or I have read this book yet, but just in talking to him, it's just so apparent how much he values parents having information and the ability to use that information and then use your own intuition, your own value system to evaluate that information and apply it to your life. Figure out what works best for you and your family specifically, which is so lacking in this world. Everybody's trying to push you a direction.
Yeah. And I think something the BOOMCLAP audience will really appreciate is that he's just a fan of common sense.
Yeah. Yep.
Just a fan of common sense, which I feel like that's what we're a fan of here, you know?
Yes, absolutely. Yeah. Okay, guys, if you're new to this podcast, if you're not, you have heard these episodes for sure, because I know they will be some of your favorites. But if you're new to this podcast, a few that those of you listening specifically to this episode will appreciate. We know back in October, we interviewed again for the second time, just the inserts. I think that episode was October 16th. Don't quote me on that, but great episode. As always, a wonderful conversation with a wonderful person doing great things for informed consent. And then we had another conversation kind of in the medical realm with Heidi Klessig on brain death and organ donation. And this is something that is not being talked about at all within any sphere, really. You know, hospital and medicine or social media, just no one's really talking about it, but it's a topic that definitely needs to be discussed. And that will be apparent to you if you go back and listen to that episode. So we appreciate you being here today. We hope you go back and listen to some of our older episodes and stick with us for the new ones. Let's get into it with Dr. Joel Gator. While I believe the doctor's office can have its time and place, I am so thankful for the ways that I have learned to take care of my family's health at home, and for the tools that I have in my toolbox, as I call it, to help care for my family when they're sick. One of those tools that I've put in my family's toolbox is homeopathy. And one of the brands that we trust is RMDY Collective. We have their first aid kit, which has a guide with a list of problems that I can go to decide what remedy I want to use. And the first aid kit has just a bunch of remedies that cover almost all of the problems that we will encounter. It's been so helpful for our family to have. If you're interested in learning more about homeopathy and possibly getting a first aid kit for you and your family, go to remedycollective.com/BOOMCLAP podcast and use the code BOOMCLAP to save 10% on your order. All right, we have Joel Gator on with us today. We just talked about your name, Gator Warsh. Dr. Gator, you go by all of them, you said. So we're so happy to have you with us today.
Thank you for having me on. I'm excited to chat.
Yeah, so I came across you by your great Instagram post. You just have this way of putting words to a whiteboard and holding it up, and everybody's like, yes, that is what I've been thinking. And then I think you ended up reaching out to us, and we finally got together to have you on. And I'm just really excited for this conversation because I know our listeners want to hear from a health practitioner who can speak to things in a way that makes sense, which you do. In preparing for this interview today, though, I wanted to hear you speak a little bit because I've seen your whiteboard post, but I haven't really heard you talk. And so I was listening to just a bit of an episode you did with RFK. I got like 5 minutes of it. And within the first 5 minutes, I think RFK spent about 2 minutes going through your credentials. And not that we're like big credential people, but I think it's really interesting how you have everything from epidemiology credentials to homeopathy. So can you give our listeners a little bit of background in how you got there?
Yeah, so I would say I'm an integrative pediatrician. And for me, I did all the regular medical training. I went to a Western allopathic school, went to Children's Hospital Los Angeles, a really good pediatrics program. But as I was going through training, I started to get more and more frustrated. And also during that time as well, when I was in residency, I met my now wife, who's also very holistic minded. And so I think those things together kind of led me down a different path. I'm a pretty open-minded person. And so listening and kind of seeing how I felt better and seeing how she lived her lifestyle, and then also seeing people go outside of the Western system and get better, it really opened up my eyes, start learning more about alternative modalities, and then really trying to blend the best of both worlds together. I'm not against modern medicine at all. I always say that. I mean, there are a lot of great things that we've invented and a lot of amazing things that we can do to save people's lives, but we're way too quick to do modern medical techniques in general these days, except in an emergency, of course. There's too many medications. We give antibiotics like it's candy. And there's a lot of discussion when it comes to modern medicine about everything else being woo-woo, even though it's not. And there are a lot of other things that are really important. And certainly with what we're seeing these days in terms of chronic disease, we're seeing the rates skyrocket, especially in, everybody really, but kids for sure. And medicine's not doing a great job of that because we don't focus on prevention. We don't focus on diet and exercise and sleep and these kinds of things. So I've really tried to blend the best of both worlds together. And, you talk about the Instagram, I just try to ask questions and try to be thought-provoking. I don't try to be controversial, though everything seems to be controversial these days, but I just try to open up the discussion because I think we need to have it.
Yeah, that's great.
So everything is controversial, right?
Yeah.
That is the truth. So would you say in your practice that you really do use like a little bit of everything, like homeopathy, for example? Do you find yourself using stuff like that in your practice as well?
Yeah, we have homeopathic remedies here. We have supplements here. We give medications. We have all of the all the regular medical stuff, and then the natural remedies. Like the companies that I like, or just some products where people can get them outside. We don't have too much in the office, but we have things so it's more convenient for people. But yeah, I think that there's a place for homeopathy. There's a place for supplements. There's a place for herbs. There's a place for discussion about diet and exercise. I mean, all these things go together, and we have all sorts of patients. We have very medical, minded people, and then we have very, natural minded people. And so sometimes people don't want medication, and unless it's super serious, we'll try the natural remedies first. I mean, I always try to encourage the natural remedies first. But sometimes we need a medication, just a lot less than I ever needed to in the past. I mean, you really very rarely need to give a medication when you have other things available because kids mostly get better on their own.
This is what really drew me to you. The respect for how the body is made and meant to work, and the foods we should be eating, the things we should be doing, but also the understanding that there's a time and place for Western medicine. I just appreciate that so much. And then you also seem to just greatly or have an understanding for what your patients and their families value and what their value system is, and respect that. And I just find that very rare.
Yeah, well, I think that's one of the big frustrations that I have with medicine these days. And maybe it's just because I'm more open-minded and I'm not really dogmatic on either side. But I just don't get how medicine went from this place of teaching. Like the name, literally, Doctor Latin is docere, which means to teach. Like that's what medicine always was. And over the last, 10 years or 5 years or whatever it is, it really moved towards telling people what to do. Like, this is the only way. This is the way you got to do it. Anything else is crazy, not respecting people's wishes. And that's so weird to me because, the first things you learn in medicine are like respecting people's wishes, like Jehovah's Witness. If you choose you don't want to, get blood, you can do that. You can give people options. Like, that's what medicine always was. And then all of a sudden it's changed to like, if you don't do my medication, you don't do my prescription, you don't do it this way, like, you're not in my office anymore. We'll see you later. Goodbye. And that's not a good way to practice medicine. And I don't know, there's a lot of parents that are super frustrated out there just because they don't feel like they're listened to or they're not respected, which is crazy to me. And I don't know, medicine's just not realizing it. Like, you look at even the data and the respect in medicine is gone. Like, you look at the recent research and like 70% of people used to respect physicians, and now like it's like 40%. Are asked. Like, a lot of people are not going to the doctor anymore. It's like you're getting the opposite effect of what you want. So I think maybe it's time the medicine looks at partnering back with people, but it doesn't 100%. Seem like that's happening.
Yeah. Cecily and I both have a nursing background. I was an ICU nurse for 15 years. Cecily was a nurse and released her license. But nursing used to be the most trusted profession. And I would say post-COVID, absolutely not. Like,
no, it's gone.
We'll trust some nurses who, will listen to them. But as a whole, absolutely not.
Yeah, no, the medical establishment used to be, like that, and firemen were always like, the people that were like the top of the list. And I bet you wouldn't be in the top 20 anymore. It's really gone, and it's deserved. I mean, people were told what to do and forced to do things they didn't want to do over the last few years. And there was no reason to do that. Like, you just tell people what you think, you give people information, you let them choose what they want to do, and that's fine. And most people will do what the doctor tells them, but then you have the option if you don't feel like it's right for you. Like, there's no logic to not doing it that way. And that's the way it's always been done. But whatever reason, it's moved in a different direction these days. And I do hope it goes back the other way by discussing it more. And I do think it is a little bit, like, I think the discussion's opening up a little bit, people a little more open to talking about things, but it's still a really weird place the medicine is right now, I think.
Yeah. Well, one thing you had said was that, parents and patients would be looked at as crazy if they questioned what the doctor was saying. I really think that's a tactic that's being used. And I don't think all doctors are like doing this in a malicious way or even are aware that they're doing it, or if it's just kind of, and I hate to say an indoctrination, but in a way, an indoctrination of like, this is what we know, this is what we believe. If anyone's outside of this, well, then you are crazy, And it really seems to be a tactic. I actually remember near the beginning of COVID here in BC, it was like right before the vaccine came out or shortly after. And our public health officer, whose name is Bonnie Henry, and her team had sent out like a survey to people who were willing to participate. And I was like, I'm kind of curious just to see what they would have in this survey. And some of the questions were like very shame-based. Like, do you worry about what your public health officer would think of you if you don't take the vaccine? Like, 50% of the questions were worded in a way like that. And it's like, man, we're really focusing on like people's fear of what medical professionals would think of them for making a certain choice. Nothing about like, how did you get to your conclusion or trying to understand the perspective, but like, wouldn't you feel shame if they knew you did not get this, And that's what I'm seeing broadly. And I don't know how different it is in America than it is in Canada. And you probably have a unique perspective on that, being Canadian, but now living in the US. But that's something that I see a lot. And that honestly, when we go to medical facilities, we feel that. I talk to so many parents who, when they go to their family doctor, come back and just say, man, I just felt like an idiot, or I felt so condescended to, I felt so not listened to. And it's a huge issue. It's a huge issue.
I think so. I mean, I think it's an issue everywhere, especially if you're naturally minded, because a good portion of doctors are not really exposed to any of this information. Like, doctors are not bad people, so they're not pediatricians, right? It's just, you're doing what you're taught, you're doing what you know, and you're doing what you believe. And if you're not exposed to anything else, you don't see it working, or you only have 3 minutes and you don't want to spend half an hour explaining to somebody why they should get a vaccine, versus not, then it's just easier to say, well, here's what the CDC recommends. Let's do it. If you don't agree with that, then don't come to my office. I think that's just easier, especially when everybody's overworked and has no time. And so we've just moved into this world where like that's okay. And it needs to move back. But there are many reasons for it. But at the end of the day, again, it's supposed to be a partnership, and it's supposed to be, the doctor's allowed to believe like, oh, everyone should get this vaccine. That's fine. Like you can believe that, but your job is not to force somebody to do it. Your job is to convince them that they should do it because you believe that they should, and you should give them the information to help them to make the decision that's right for them. And ultimately, if they choose to not agree with you, then that should be fine with you. Right. But that doesn't seem to be what's going on. It's like, do this. If you don't agree with me, then go somewhere else, or I'm going to shame you into doing it. Which I don't know. This is not a good way to practice, and I think that's why people just don't trust doctors anymore. And now I hear more and more patients coming and saying, "Well, I used to do X, Y, and Z, and now I don't want to do anything anymore because I trust nothing." And that's bad too. Because not all of medicine is bad. I mean, there's a lot of good things, and even still, like most doctors are good people. I just think they need exposure to things. And a good example is like acupuncture, right? If you ask a doctor about acupuncture, like 20 years ago, they would have said, you're so woo-woo. And now you have an opioid epidemic and we don't want to use opioids so much anymore. And so then what do we need to do for pain? Then every hospital has acupuncture in it now. It's like not woo-woo at all. So medicine's behind. It always is. But it's just hard with natural medicine because you don't have the research and the data and the way that you have it with pharmaceuticals. And the pharmaceutical companies have so much money and they have the power, and double-blind controlled trials are only going to be done on medicines. So you don't have the evidence that someone who's extremely scientific medical would want, even though it still might work really well. They just don't have that information. I mean, there's lots of data out there about supplements, but you can't really get that information unless somebody does those studies, and no one's going to spend $1 billion to do it except a pharma company. And why would they ever be biased about their products, right?
Right.
Why would you not tell somebody that it works better than it does or doesn't have a side effect if you are going to make $1 trillion, right? Like obviously you would. So that's where we are.
Yeah. Well, they can't even, FDA doesn't even deal in approving supplements for anything. So there's a problem there. But I would argue like we don't have information, like scientific data to support natural remedies and things, but maybe in the like positive sense, like we haven't tested these things, but in the reverse we do, because as we've moved away from natural living practices, we've gotten sicker. So if we just like reverse our mindset, we have the scientific evidence. It's just not done in paper form going into a medical journal. So
right. We have, but that's the thing is like we have this common sense, right? This like innate knowledge of what keeps us healthy. And I think there's been, for so long, people were dying young for infectious disease and all these things, right? So a lot of medicine is good, right? We went from dying when we were 40 to dying when we're 70 or 80, right? Like that's a good thing. So there's a lot of good stuff that's come out of medications, acute disease. I mean, that's what medicine, why it became so popular, because people would die, or you'd have something, you go to a surgeon, you get better, something that would have killed you, or you could get an antibiotic and it would save your life. So doctors were very popular. And then now we've moved to, okay, that's good, but chronic disease has crept up. And now life expectancy is going back down. We're terrible at dealing with chronic disease. Every condition's skyrocketing. And so we have to go backwards now, which is always hard to do, and say, okay, well, what were we doing better about some of these things 50 years ago or 30 years ago, and balance the best of both worlds somewhere in the middle. But it's really hard to fight against pharma companies because they have all the money. And anytime you talk about just getting outside or getting some vitamin D or eating healthier, it's like, no, that's crazy. You need a medication. And it's going to take a lot to push back on that. I think it's happening a little bit, but it's not the easiest thing to fight against that momentum. But we don't need a double-blind study to look around and see what's going on and see all the chronic disease and realize that eating healthy is, good for you, or getting sunlight is good for you. Like, I don't need a study for that, and we're never going to have it. So we're going to have to combine studies with some common sense and, again, find some middle ground there.
Yeah. Amen. So I guess, so some people that I talk to would say like, it's really hard to find a pediatrician like you. And I guess as a pediatrician practicing the way you do, you would know, are there more of you out there than we think? How is it? Not really.
There are certainly a few, right? I mean, there's integrative doctors. There are people that are a little more open-minded. But, most people go through the medical system, and there's not a need to learn about integrative medicine. You have to be interested in it to go learn it yourself. So yeah, some people are starting to learn about it, but I mean, it's reasonable to look, there certainly are some.
But you specifically deal with pediatrics, right?
I do. I would say most integrative doctors deal with adults, but there certainly are some other integrative pediatric practitioners, but there's some family medicine doctors that will do both. So that's something you can always look for. There are naturopathic doctors that do this as well and work with kids. So sometimes you can have two, you can have your pediatrician and your natural practitioner, a chiropractor, somebody that works with kids. And then kind of have a little bit of both. So you can go to your doctor for the acute thing, and then you can go to your natural doctor for everything else. So that's always an option. And that's also why I wrote my book too, for young parents too, Parenting at Your Child's Pace, because I wanted to go through the big questions that people have, talk about things from both sides, talk about natural health and foundations. So I think there are resources out there, but there's not a ton of integrative pediatricians, because you really have to go outside the system. You can't, even at my office, I still take insurance, but we have, a membership kind of hybrid model. There's just no way to spend more time in the regular model that you would need to even be a little bit integrative. So it's just not something that's around a lot, because you can't spend 30 minutes with a patient in the modern system right now.
Yeah. So do you find your practice is like, do you feel overwhelmed, or like people are knocking down your door trying to get into a practice like yours?
Yeah, we have a lot of applications. I mean, I don't take that many patients anymore. I've never had to advertise, which is great. I mean, there's such a interest in it, way above anything. We could probably have 20 doctors and it wouldn't be a problem to fill it. There's just not people that want to do this or that are that open to it. So I hope that as more and more people are interested in it, and the younger generation of doctors moves through, they're going to be more interested in this. We're talking about it more, and so more and more people will take it up. But it's certainly slow process.
Yeah. Okay, so one thing I wanted to ask you, because you talk about so many things that are just like, yes, moments on social media, but it's such a wide variety. What is the number one thing that you're passionate about talking about right now to parents? Like, what do you think is the number one thing parents need to hear?
I would say that there's this wave of a realization of the chronic disease epidemic that's going on, and really discussing how much power we have as parents over chronic disease and over these things for our own family, and kind of taking back that power for our family, and knowing that it's not woo-woo and it's okay to kind of be, the crunchy parent, I'm air quotes, or whatever it is that you want to call it, and really focusing back on their health, cooking more, thinking about what foods you're buying, thinking about reading the labels. Like, all of this stuff matters a lot. And I'm really trying to focus as much as I can at the individual level. I think there's some big things that we need to do as a society to make changes, but that's not going to happen overnight. I think it's good if you want to get involved, and it's good if you want to do those things. And I'm trying to do that more too. But in the family level, like, you can move to the middle of the forest, and some people do, right? You did it. But most people are not going to do that. So I think, what are the simple changes you can do at home to increase your resilience, increase your chance of being healthy? I think that is what is most important right now, because I think if you do those things, you can, for the most part, have a healthy family, and you can certainly decrease your risk of all these conditions, which are skyrocketing. And, we haven't talked about stats, but like 50% of kids have a chronic disease. Autism rates now are like 1 in 36, 1 in 22 where I am. Developmental disorders, neurodevelopmental disorders, 1 in 6. Mental health, 50% of teens have a mental health diagnosis. 1 in 3 kids have diabetes or pre-diabetes. Like 50% of kids are overweight or obese. It's the numbers are so staggering. It's like half of kids have something. And so if you don't want your kids to be that next statistic, then we have to do something different. And if your kids do have a chronic condition, then there are things that you can do to improve them, to help get rid of the diagnosis, maybe to decrease the medication. I mean, there are things that we can do to help those kids. And why not do that if we can?
Yeah. What would you say is, like, maybe this is a weird question, but what would you say is the most frequently seen chronic disease that you see in children? Or like top 2 or 3?
Allergies, eczema, I would say, are probably the most common, because eczema is so common amongst kids these days. It's like basically normal that you would have some eczema at this point. allergies, it seems like every kid has some sort of allergy to something, or food sensitivity. And then like obesity, overweight, diabetes, metabolic dysfunction, very common these days as well. And then all the neurodevelopmental, like ADHD, autism, learning disabilities, everything on that, that range of conditions is also skyrocketing as well. And then all the mental health stuff too. So yeah, everything. But I mean, eczema and allergies probably the most.
Yeah.
Okay. So learning disabilities, I think most people wouldn't equate that to a condition that is medical in nature or anything that could be changed. So what would you say to that?
Yeah, I don't know that that's true. I mean, I think that I think we have to think about these conditions a little bit differently. Like the way that I think about it is about like diabetes, which like we have this model that is so clear and so normal to us. Like we have type 1 and type 2. And type 1, it's a little bit more genetic. It's affecting, obviously what you do matters, but it's like a little bit more genetic versus type 2 is like very much about what you do in your lifestyle. And, for years it was like, okay, well, if you eat better and you exercise more, we can get rid of your type 2 diabetes. Right. And I think that's true of almost every condition where there's kind of two different types or multiple different types where there's a very genetic conditions, of course, and there may be nothing you can do to get rid of that. Like cystic fibrosis doesn't mean you can't help the condition, but it's there as part of your genetics. But I think a lot of these conditions are related to our lifestyle. And if you're talking about like a learning disability, so there may be some sort of genetics that are involved. Maybe there's a brain injury or brain insult that has affected your ability to learn. But I think the vast majority of the increase is just inflammation in the body, inflammation in the brain, not giving your body the nutrients that it needs to function optimally. And so that expresses itself in different ways. One of those ways being a learning disability, because if your brain can't function optimally, it's going to be hard to learn, hard to study, and hard to focus. And so I think that if we make some of those changes, then for some of those kids, their diagnosis will go away because it's totally related to food or lifestyle. And other kids, it won't. But I think a much bigger proportion of kids actually have a chronic condition, which is really lifestyle and is not actually genetic, or maybe just they have genetics, in which case it makes them a little more susceptible to it. So they express it a little easier than other kids. But if they ate really healthy and exercised every day, they wouldn't have that condition.
Yep. Agree. Okay, so one thing Cecily and I we were talking last night about like, oh, we got this podcast tomorrow and just discussing what we want to discuss and everything with you. And sometimes our conversations lead to us to a place that we're like, we didn't even know we wanted to talk about this. But I was talking to Cecily about how I get messages from people like, well, what do you do for your kids? Because we don't go to a pediatrician anymore. We stopped well child visits, I think, when my 10-year-old was 2. I'd have to look back, but we just don't do that anymore. And so we have a 18-month-old now. He's been to the practitioner we chose to see twice, once to just get acquainted, and then another time to get acquainted again in case we had a need last winter, but never for an illness or anything, just for, familiarization. And I feel comfortable with that personally. Maybe not everybody does, but I get messages like, well, where did you find this person that you feel comfortable taking your kid to see that agrees with your values and all of these things? And so Cecily and I were talking about this, and she's like, well, in Canada, we don't even have pediatricians. Like we just go to the family doctor. I'm like,
well, we do, but it's like only if you're really sick do you go see a pediatrician.
Yeah. But like when I was a kid, we had a family doctor. And it was the same family doctor that delivered you when you were born, that saw you when you were sick, that your mom called when you were sick, and they really knew you. And sometimes you didn't even go to the doctor. They just talked to you over the phone what you needed to do. And so we're now in the situation where everything is so specialized and compartmentalized, and your physician doesn't even know you sometimes. I don't know. Do you have any thoughts on that? The way we're doing medicine in America in general, from that standpoint of like specialties for everything?
Yeah, well, I think that, there's a good specialization in terms of, you want your neurosurgeon to be really good at doing neurosurgery, right? But I think that the problem with what we've done, the big problem is we've really incentivized specialization, and the body works in, the whole body is a body. There's not like just a brain. You don't just have a heart. And so those people get really good at that one thing, but then nobody is really good at looking at the whole picture or stepping back, or really like looking at the chronic disease epidemic and being like, well, a lot of these things actually have a similar root cause. And so we actually need to work on those things first. Like maybe I don't need to get surgery, for this issue, or maybe I don't need to take this medication because the actual thing I need to do is work on my lifestyle. Like you can go to the psychiatrist, right, and get your ADHD medication, but maybe the right thing was actually for them to work on what they're eating first. And maybe if they change that, then they wouldn't need the medication. And it's obviously specific to each case, but because we've gotten so specialized, it's really easy to send people to 10 different places, get 10 different medications, send them on their way. And no one ever really thinks about you or the root cause of anything. So yeah, I think that's a big problem. I think it's a big problem for people not to feel comfortable having a doctor in general. It doesn't matter whether it's family or pediatrics. I mean, every place has a little bit different. In America, pediatrics is pretty standard because there's lots of pediatricians. In Canada, there are pediatricians, but maybe family doctor, but they're going to be doing the same basic thing. So I think it's useful to have one. The issue is finding one that you like, right? Because you don't want to go somewhere where you feel shame, but ideally you'd have someone where you would go to where you would be respected and you can have a conversation, even if that means going in just every once in a while. It's still better to have somebody you can trust, because you never know when something's going to come up. You never know when your kid's going to get a bad cold that turns into pneumonia, and you don't want to have to go to the emergency department if you don't need to, or maybe you'll be worried about something looking cancerous or whatever. Like you want to have somewhere you could go if these things do pop up, unfortunately. But if you don't have anyone, then you're scrambling to find someone random or going to the emergency department, which is bad too. So I think it's still worth to have one. Even if you don't go all the time, I think it's worth to put the effort in to find something that you like, as opposed to trying to do that later. And there, wherever you are, there are people, even if they're far away. If you're not going to go very often, then, maybe you ask around, you ask some friends, you look on mommy groups online that are naturally minded. Like you can ask, and there are people all over the place that do it. Even if you find someone who's cash pay, if you're not going very often, then at least you have someone if you need it. And now with telemedicine, that's also an option too for some things. So, I mean, there are options if you put the effort in to look for somebody that you can respect and trust. And I think that's a worthwhile thing to have.
I totally agree. I guess my thing is I have a plan that we can use, but I plan not to use it. Hopefully, that's kind of how I go about it. But I want somebody that I can actually see. I don't know. Maybe it's different in California, and maybe this is a state by state thing or a facility by facility thing. But the large facility in our area, the one I used to work at, where most people go, you might have a pediatrician for your children. And you can schedule out and see them for a well child visit, but you don't see them if you're sick. They have a doc on call that is there on call for the day, taking all the sick kids. And so your doctor that actually knows you when you have a need doesn't even see you. And I think that is so horrible. That's a horrible system, in my opinion.
Yeah, well, that's where we've moved to, right? I mean, medicine has become much more corporate, and almost every office has been bought up by a larger facility. Especially in the States, and for sure in Canada. I mean, my family still lives in Canada. I know, when my sister has to take her kids to the doctor, they don't even see them half the time. Yeah. They just say to go to urgent care because they just can't get you in. Sometimes we'll get patients that'll be coming to our office, or that want to come to our office. They'll be like, oh, we were at UCLA or someplace, and we had a concern, we wanted to get seen, and they had to schedule a visit for 3 weeks from now, and our kid would be dead by then if it's a real problem. So I think that's a big problem with big systems, because they literally don't care. They just a numbers game, and they're just trying to get you through. Yeah. So you definitely won't have any sort of personalized care in a big system in general. So I think that's true. If you're naturally minded, it's probably not a good spot to be. You got to find a small practice that's still independent. That will be your only shot to really see your own doctor consistently, because most places now are scheduling out weeks or months out. So it's not very helpful. But if you go to a small practice with one doctor or 3 doctors, then they will, probably see you themselves.
Yeah. Okay. One thing you've talked about too is admitting that you're wrong, being able to admit you're wrong. I think that you had mentioned, I don't know if it's on social media or where, but that I think it was with crawling, like with babies crawling. And you had mentioned maybe it's a milestone. It's something that babies need to do, but it's not that imperative for them to crawl in a specific way or a specific time frame. And then people had come and like re-educated you that this is actually pretty important to their development and it's a developmental milestone they need to meet. And you were like, well, thank you for helping me learn about that. And I'm like, well, that's rare. Most medical professionals really feel this need to like say, I'm right. Even when they kind of are proven wrong, they want to stick by what they say because it's almost like if I say I'm wrong, no one's going to trust me. And really, like, maybe we do have a problem with that in America. Like if somebody admits they're wrong, not trusting them instead of realizing this is a great reason to trust this person because they're going to be honest with me. So I guess why is medicine so arrogant?
That's a good question. Medicine, for sure, it's very arrogant. It's crazy that people just won't discuss things that they learn as they go. I mean, it doesn't make any sense. I mean, obviously, you don't want to be wrong about everything, right? But there are so many things that you learn as you go. There's always new information, and certainly, as a physician, there are so many other practitioners out there that do other things, that do it every day, all the time, and so we should listen to other people when they're telling us things about stuff that maybe we don't know as much about. Like, I don't know why doctors think they know everything about everything, but certainly you don't. I mean, you know a lot about pharmaceuticals, you know a lot about surgery if you're a surgeon, but there are many things that other people might know better. And so I wish that, people would be a little bit more humble. And the situation you're mentioning, I think was very interesting because they changed the guidelines, the developmental milestone guidelines. And one of the things that they did with that was to take out crawling as one of the important milestones. And I always had learned about crawling and it was part of the things you asked the parents, but it's not something that I ever really considered like extremely important, right? It's like, you don't need to crawl. If you're not crawling when you're an adult, really. So if I guess the scenario is like a child who goes straight from sitting to walking, and they never really crawl, is that a problem? That's kind of the question. Mm-hmm. And I was asked that, and I didn't think so. I mean, I didn't think that was a big thing. But then when I was talking about that, a lot of the therapists were like, no, it is really important, and here's why, and it's really important for learning. And so even if they do walk a bit, I wouldn't say that's necessarily an issue, but you should still work on crawling because it's important for your brain development. And it's really important to work with that on kids because it's actually one of those skills that actually we do think is important, and it's good for life skills. And a lot of times when we look back on kids that do have neurodevelopmental issues, they never crawled. So we think it's important. And I was like, okay, that makes sense, right? I still don't think that like I'd be super duper concerned or send a child off for evaluation just because they're not crawling at 9 months. But I think at the same time, it does make me change my opinion if a parent asks to say, well, yeah, even if they're not crawling, you should still work on it. It's still an important skill. And I don't know, occupational therapists, physical therapists, they know a lot more about that than I do. So why would I know anyway? So if that's what they think, then that makes sense to me.
Yeah. This is what I appreciate about you. Like, I feel like I very much relate to your way of thinking. Like, I feel like there's this pendulum and we can swing too far one way or the other where it's like, we're so worried about crawling. We're like, my kid didn't crawl. And I'm like, okay, in the scheme of things, in the scheme of what's important in life, I think they're probably going to be okay. Comparatively to, especially if you look at the whole of America and American children. But at the same time, like to say it doesn't matter at all and throw it out the window as even thinking about it mattering, that's also not a good way to be. So I just appreciate your balance. Like, I really do. So.
And most things should be that way. I mean, most things are in the middle somewhere, right? We move to extremes a lot, or at least people in the extremes are louder, but most people are in the middle somewhere.
Yeah.
Yes. We could stay there for a while. It's that time of year where everybody's starting to think about fall and making their homes cozy. And one of the best ways that I know women these days think about making their homes feel cozy and fall-like is with scents of pumpkin spice. And not all of those scents are healthy to be breathing in, healthy to be putting on your skin, but Rowe Casa does offer a pumpkin spice line you can feel good about. They are back with their hand cleaner, their lotions, their candles that are all pumpkin spice scent and perfect for the fall season. So go to RoweCasaOrganics.com and use the code BOOMCLAP to save 20% off your order. Okay, funny stuff on your Instagram too. I'm sorry, I keep mentioning Instagram, but that's where you kind of live as far as your presence to people outside of your practice, right? So that's where I know you from. But anyway, you had this reel and I sent it to Cecily and I was cracking up. I had seen it somewhere else. It must have been a repost, but this guy wearing a wig. And maybe I'll find it and pull. I don't know. Maybe I should play it for our audience because it was pretty funny if it's not too far back here. Yes, I have it in my messages. So here, I'm going to play it.
Karen Dweeb, a certified child behavioral and parenting expert. Instead of yelling at your child from across the room to get them to put their shoes on, you should calmly walk up to them and crouch so you're at their level. And if you can, pull up 2 chairs. First, ask them permission to have an open conversation, then validate their feelings of frustration and emphasize your acceptance of their emotions. Politely suggest a collaborative solution. Discuss the origin, meaning, and definition of the word shoes. And it may be helpful to draw a picture of shoes or allow your child to make a clay sculpture of a shoe. Provide context for your requests and suggest 3 benefits for putting shoes on, and then educate your child on the consequences of not putting their shoes on. After about a 45 to 60-minute conversation, you should be able to arrive at some common ground. I'm Karen Dweeb, a certified
I appreciated that.
I like that. Made me laugh, that video.
Cracking up again. Yeah. It's not even the first time seeing it.
Yeah, no, I mean, I thought it was just funny because it was like, you see people talk about this stuff all the time with gentle parenting and, I mean, boundaries are important and it's important to set reasonable, balanced boundaries. And there's just so much, I mean, everything's a pendulum like you were talking about, right? And you go back 50 years, 100 years. I mean, it was very like authoritarian. You do it my way, spanking, all this stuff. Obviously, we learned from that. And maybe that's not the best way to parent. And, most of the research shows that at this point. So then we kind of swung the other way to permissive parenting and also not great, right? I mean, gentle parenting was never really meant to be like, just do whatever you want. But I think people ran with that. And then you get these kids which have no boundaries and you feel like you need to explain everything to them forever. I mean, obviously explaining things to kids is good, but you have to have some sort of reasonableness. And I think why that's funny is because it's so like the extreme on that side of like letting your kid do what they want and explain them everything. And it's like, no, just like you have to do this thing. Like that's real parenting. And if we did parent in the way like in that video, like you would not have good kids. Also, like there's both sides. If it's too extreme, are not going to be good. So you have to be in the middle somewhere, and they want to parent with boundaries too. So yeah, I thought that was funny.
It is funny, and you do see like obviously that video was exaggerated, and that's funny. But the language that they're using, oh gosh, what are some of the buzzwords like restorative and this and that? You see it in big industries as well, in big sectors like the public education system. You see it in like nursing, for example, staff meetings and stuff. We would have these conversations that were just filled with all these buzzwords that even though it's not gentle parenting, all of these movements, I guess, they borrow language from each other and it's applied so broadly across culture. And I guess the whole culture is swinging on that same pendulum in a way,
Yeah, I think we've swung very far that way, and I think it's swinging back a little bit. But there are times to be mindful and times to be gentle. But that style is also not good. It's almost like I'm trying to, I don't know, virtue signal how great of a parent I am by being this certain way, and you want to do what's best for your kids, not what makes you look the best. And so I think there's a lot of that going on.
I mean, we could stay there for a second too. Like you want to do what's best for your kids and not just what makes you look the best. That's a big thing. Like I think it's a difficult thing for parents to admit, but there's a lot of pride that goes into how you think people perceive you and your parenting choices and the way your kids are behaving or interacting. It's a big thing. Like even if people don't want to say that judgment affects them, I believe that it probably does. And like that's like going back to the beginning of our conversation, like where I would have people come to me often and say, oh, we went to the doctor and I felt this way because of, the conversation. But it's true with so many of our parenting choices. And so often, especially in an Instagram type culture, it's like, okay, are we doing that because it's best for the kids, or are we doing that because that's what's going to make you look the best according to someone's standards?
Yeah, right. And I think even that goes back to kind of the title of my book, like Parenting at Your Child's Pace. And
Right.
a lot of the book is really about like synthesizing information. I mean, it's okay to learn, right? It's okay to watch Instagram. It's okay to Google something, but you have to kind of take that in the context of what's going on out there, and recognizing that everything's very much about either division or anger or fear-based to get you to click on it. And so or someone's trying to sell you something. So there's always some sort of ulterior motive to almost everything these days. And so it makes it really hard to be a parent because you have all these different conflicting viewpoints. And I think it's something we never were taught because we didn't grow up with all this stuff. But like, you have to get really good at looking at all that information, synthesizing it, and then figuring out what makes sense for you and your family. And trusting your gut as a parent, trusting your mom gut, trusting your dad gut, and then figuring out what makes sense, watching your kid, and then making changes as you go if it doesn't work. But just kind of following what the trends are is not always going to be, or usually going to be, the best thing for your family. And there's just a lot. I think it's really tough to be a parent in many sense these days. Like it's not actually, I think, because we have more information than ever. We have more resources than ever. We just feel like it's harder because you go back 50 years and it was like, okay, well, I don't know. How did you start feeding your kid? Oh, I did this. I gave them peas at 6 months, right? I gave them carrots at 6 months. Okay, I'll do that. Now you have everybody giving you a different opinion. Social media influencers telling you, well, if you give peas, your kid's going to die. So don't do that. And you're like, but my grandma just said, so you have all these conflicting opinions and no one ever taught us how to synthesize that. And it's hard to know sometimes who to trust or what to trust. So really you have to get back to trusting yourself and getting that information and then doing whatever makes sense for you and just trying it. Most things are not that urgent. And even if you get it wrong, then you can just change. But it seems like a lot of these decisions are urgent, like what to feed our kid, or baby-led weaning, or when to potty train. And you read a book and it's like, oh, if you don't potty train before 2, your kid will never do it. You missed the window. And then you read the next book and it's like, oh, you should do it at 3. It's much easier. You're like, right. I don't know what to do. Everything just seems so urgent, and it's not usually urgent. Yeah. So yeah, I think that's where where it's tough to be a parent these days. But I mean, we have more safety standards than ever. We have more access to everything than we ever had before. So it's not actually harder, it just feels harder.
It's a perception. No, you hit the nail on the head there. So a while back, I was out with some friends, just getting together, talking about things. And one said to me, you always seem so sure about everything. Like, why are you so sure? And I'm like, well, I'm not necessarily so sure. It's just, I try to do my research and figure out how I feel about something, what makes sense to me. I feel like it's my responsibility to try to figure out like what makes sense, what's most true here. And she said, I wish I could be that way. And then she said that she just doesn't trust anyone. She's like, because you can find, you can look at one issue and find completely differing perspectives on it with the studies to back it up. And she's like, and how am I ever supposed to know what's true? She's like, so I just find myself not trusting anyone. And I'm like, yeah, I get it. And she was like, well, what do you do about it? Because you seem sure. And I'm like, I don't know. So maybe this is a question for you. Like, there's so many people I think that are just feeling like they can't trust anyone because anyone can make anything sound right and true,
Well, exactly. And that's why I say you have to trust yourself. Right? You have to trust your own gut to make the best decision based on the information that you have for your family, because you don't know what's true. Even if a person is completely honest and you're like, oh, I can totally trust that person, they could be wrong too. Like you might be wrong because you don't know information that, comes in 3 years from now that we don't even know yet. So the key to being that confident, I mean, even if you don't feel confident, is just trusting in yourself to be able to look at the information, try to synthesize it, and just know that you're going to do whatever you feel like is best for your kids. It may not be the right thing. Most of the time it's probably not going to be. You're going to make a choice and you're like, oh, okay, well, let's do it this way. Or if you feel like you should know what to do, that's where you run into stress. Like you can't possibly know what to do for your kids, because anyone who has 2 kids or 3 kids, whatever works for the first one doesn't work with the second one. So you can be like, you did all your research on potty training. You're like, all right, this one I'm doing at 18 months and it works perfectly. And the next one's just peeing everywhere, right? And they're not ready yet. So it's like you have to look at that kid and figure out what's working and then try things. And that's how you become confident, because you just feel like this is the best thing for your kid based on all that information. You don't know who you can trust. You try to, I guess, weight things based on who you feel like you can trust more. Like I think you should trust your family in general more, people that know you more, or you like your doctor, maybe you trust your doctor, or there's a certain resource, or maybe like an American Academy of Pediatrics guideline. It's like, okay, well, this is like, I might not trust everything, but like there's a lot of people that worked on this. They're probably not trying to lie to us. Like this is a good piece of information. I can weight this pretty heavily. Maybe like, sleep, let's say sudden infant death syndrome. Like, okay, well, a lot of people have done research on it. We know the best way probably to decrease the risk of sudden infant death syndrome. So I'm probably going to put them on their back. But maybe for your kid, that's maybe not the best thing to do. Like maybe there are other things, or maybe somebody else gives you information. So I think you have to weigh those things and decide what you feel like you can trust the most. But you can't really totally trust anything ever. And so at the end of the day, you just figure out what you think will make sense and try that. And again, most things are not urgent. I just think that we now think that things are so urgent because people scare us a lot about everything all the time. And you're like, oh, well, I don't want to not have the de-choker. So I need to like make sure if my kid's choking, then I have this thing at home. Or if my car goes into the water, I need the thing to cut my seatbelt or whatever. Like all these things that were advertised to you that you never even think about 50 years ago. So you think you're not prepared. You think you're like, oh, I don't have all the stuff for my nursery when I have a new baby. So I'm not prepared. I'm not a good parent. When you don't need anything, you need like a box for them to sleep in and some diapers and some wipes and some clothes and you're good to go. Like that's what people do in the world. So
yes,
I think if you like take it from that perspective, you'll be less nervous because you're like, well, there's no way to know what to do.
Oh, good.
Yeah. I think discernment and intuition are at an all-time critical low, but they're critically necessary right now. And just like you said, all you need is a box and yada, yada. Like we had our third, we live in a really small house and my daughters already share a bedroom. And so people are like, well, what are you going to do about your house? I just laughed. I was like, people used to live in a one-room shack with a dirt floor 100 years ago. So I think we're good. Like, I think we're going to be fine, but it's just like all these problems, or not all of these problems, but a lot of problems that we currently think about on a daily basis weren't problems years ago and are things that we've created with our modern lifestyle. So it's very interesting.
Exactly. I agree. I think we're worried about so much and maybe not always the right things. We're worried about the wrong things and we're worried about it so much. I mean, there are things to worry about in the world, but it's really hard. I mean, it's good to be aware of what's going on, but I think we're so over aware of like every bad thing that happens in the world all the time now. Instead of, when we were growing up, it was like, oh, you watch the news maybe, and you watched for half an hour and you saw the bad things that were going on in the world. And that was that. You went on with your life. And now it's like a constant stream of every horrible thing that's happening in every place around the world. And it seems like everything is worse, even in terms of like abuse for kids and like things like obviously there's bad things, but the numbers for the most part are down for almost everything. But you would never know that. I mean, you would be more afraid of everything. I don't know if you saw that like post about sleepovers, but that one like blew my mind. I didn't even think about sleepovers as being an issue. And like basically everybody was like, no, you should never let your kids sleep over. And I think there's obviously been some trauma through sleepovers for some people, but I think also we're just like so hypersensitive to all the things that people have heard about over the years. And so we're more worried about certain things than maybe are reasonable. So I think it's reasonable to be aware of these things, but at the same time, it's like we just hear the worst case scenario for everything. And so that brings out a little extra fear that maybe just was never there before, for good and bad.
Yeah. Well, and that's happening for parents, but like it's got to be happening for kids as well. Like you were saying, you're seeing massive increases in mental health issues. Probably a contributor to that. I mean, there's probably a lot of contributors, but this is one of them, right? This constant stream of information that we're just being assaulted with every single day. And I say assaulted, and that's maybe not fair because obviously
It's fair.
Yeah, but we are making the choice to like pick up the phone and like expose ourselves once again to the world. But yeah, it feels like an assault a lot of the time. Like, oh my goodness, like all of this stuff that I never would have known about. And just thinking of my own childhood, which doesn't feel that long ago, or even like, my early 20s, however long since the iPhone came out, like in 2000 something, 7 or something, life was so different. And I feel like people's coping mechanisms were so different, like, it's like if you were, I don't remember ever being bored when I was a kid. Like that was not a sensation that I ever had. And I know that that's not necessarily normal for all kids that grew up in the 90s like I did, but I just was never bored. Like if I had a quiet moment, I would like read a book or go outside. And, now it's like if someone has a quiet moment, they're reaching for a device, and so there's just this huge shift in how we handle those moments where there's nothing going on. And now we fill those moments with all of the terrible things that are going on in the world. And I just think, as much as it has an impact on adults, which obviously then has an impact on parenting, it's having the same impact on kids, even if they're not themselves seeing this information as often. I know a lot of kids are receiving a lot of screen time, but I think even those that don't are probably experiencing the impact of this culture.
Yeah, I think so. I mean, I think it's a huge problem. And that's why I think it's one of the big issues this year that is being discussed. And there's a lot of pushback for getting phones out of schools and teens on social media later, because the research is pretty clear at this point that it's very bad for you. I mean, I don't think we need research for that. I think everybody knows it. But I think the research has kind of caught up to it. And other countries in Europe that are taking phones away, they're seeing really great improvements in focus in school and better academics and fewer visits to the counselor and all these things, which I think are just so obvious. Obviously, if you're not looking at your phone all day, you're going to pay attention, you're going to do better in school. That's not that complicated. And if you're not distracted by all the horrible things going on or the text messaging going around, then you might actually talk to somebody.
Right.
So yeah, I think we know those things, and we know mental health is a disaster for kids. Like 50% of teens, I think, at this point have a mental health diagnosis. So it's very high. And average amount of time on a screen for a teenager, 7 to 9 hours. Like that's a lot of hours. So then you're not outside, you're not playing, you're not socializing with people in the real life. So yeah, I think we kind of know this, and I would say that screens are not inherently bad and they're not going anywhere, but it's what we're doing with them and what's on them and how much we're on them. That's the problem. And what we're not doing, like moving, is the problem. So I would say, and what I usually talk about is just let's start to work to minimize it, decrease that screen time. Let's get back to a more reasonable place. Don't get on social media too young, push that age back. I think the more that we talk about it, the more it's going to be okay to do it. And as long as enough kids are not on, and you're not going to be the only, it's hard when you're like kid's the only one that's not on something. I think that's hard. But if a good chunk of parents say, no, we're not going to let our 12-year-old have social media, then I think it's okay and much easier for everybody to do it. And I'm glad this conversation is happening, because they're like a 13-year-old shall not have a phone in school. They don't need it. Like it's certainly not one with internet. I mean, if you want for contact, texting to pick them up, emergencies, fine. You get them a flip phone. I think that's plenty. They don't need access to Instagram in the middle of math class. They're not going to be able to pay attention. So I think if we just push back on that, it's going to be so helpful, and it's not that complicated.
For sure. Kind of like food, like healthy food. We know fruits and vegetables and meat, like these are good things. But for some reason, it's like, well, let's go for the packaged food. Like we know it, but for some reason, things are taking a while to change.
Yeah, I think we know things, but there's a lot of momentum, and there's a lot of push from companies who have all the money to kind of push things in a certain direction and push away when you talk about common sense stuff. But we have to get back to like the most common sense things, like moving is good, eating real food that you just picked is good, not being on your screen all day is good, being in nature is good, getting some sunlight. I mean, these are basic human things. We don't need studies for any of that. We just need to do it more. And if most people do those couple of things, you're going to be way healthier. You don't have to do that much more. You don't have to, build your own farm. You just, like these things we know. And I think if we do that, then most kids will be healthy. They'll be fine.
Yeah. Okay, I have a couple more questions for you. One of them, I know if I don't ask, our listeners would be upset. Like, how do you handle the vaccine conversation with your patients and
Yeah,
families?
so for me, I don't force anybody to do anything. I don't think anybody should. We have conversations around shots and the pros and the cons, and then people make whatever decision makes sense for them. I mean, some people do regular schedules, some people do slow schedules, some people don't do it. It's just really up to them, and we just talk about the risks and the benefits to the best of our knowledge, which is limited, but it is what we have. So, people make the decisions that make sense for them.
I guess, do you have an opinion going into it do you just have a conversation, this is the risk benefits, or do you have an opinion like that you hope for with your patients, or and you don't even have to share that, but.
No, I mean, I don't, for most things, I don't think it's my job to tell people what to do. And regardless of what my opinions are, I don't know that matters that much. I mean, I think that it matters in the sense of giving them the best information that I have, especially with shots. There's a lot of information missing, especially with long-term risks. So I think it's really hard to give all the information because we don't have it. But the standard is to do vaccines. And so as a doctor, you kind of are stuck. I think giving that information and kind of promoting vaccines, regardless of what you believe, if you believe in them or you don't believe in them, or you want to do them or you don't want to do them, that's kind of the standard of care. And so I think that's kind of the baseline for any doctor. And most doctors really strongly believe in vaccines. Not every natural parent does, obviously, but I think doctors really do truly believe in it for the most part. For me, I obviously have been outside of the regular system for a long time and have seen a lot of other stuff. So I just try to give information and let people choose whatever they want. I would get in a lot of trouble if I push people away from doing anything. And so I think that the reality is that it's not my position to do. It's up to them to decide, but I don't think I should force anybody to do it or tell people to do it. I think it should be up to them to decide what they want to do.
That was my follow-up question as far as getting in trouble. Do you feel like there's pressure in California specifically? Because I hear from a lot of parents that are in California, like, we don't have exemptions. Like, if we don't get this, we can't go to school. And so I don't know, is that 100% true that you have to have, there's no exemption? Or there's no philosophical, right? Or religious, but there is medical or not?
There is medical. So there's always medical everywhere. The issue with that is that it's very narrow guidelines for what is considered medical based on the CDC. And so depending on where you are, the rules are different. So there are a couple different kinds, but there's religious exemptions, there's personal belief exemptions, and there's medical exemptions. And so for a medical exemption, you go to your doctor, you have a medical reason to not get it, like you have an autoimmune condition, like HIV or something where you can't get a vaccine, you had an anaphylactic reaction to something in the past. So that you can get a medical exemption for because you're allergic to something in there. But that's pretty much it in terms of getting an exemption, especially in a place like California. It's very strict. So, I mean, I don't know if there's pressure per se from that sense, from a doctor's perspective, because there's really not much you can do. I mean, the rules are what they are. So I think the pressure is more on parents if they don't want to do it to figure out what they want to do.
Right.
But a lot of the decision making here is kind of taken out of our hands because everything goes through public health. So, people don't want to do it. Then it's like, okay, well, then you can't go to school here. That's just the rules, and you can do what There's no requirement to do vaccines anywhere. The requirement is for school.
Yep.
So that's where the pressure comes in for parents. If they don't want to homeschool, then that's a decision they have to make, whether they were willing to do it, even if they don't really want to, or whether they want to, make other decisions. So California is a very strict place. There are a few of them, but I think, if you're not interested in vaccinating, then there's pressure everywhere. But just some places are easier than others because they have, personal belief exemptions, and so that you can just decide you don't want to do it. But the trend has been moving away from that.
Yeah.
Wow. I didn't realize that they literally couldn't go to public school. Because I always feel like
any school.
To any school.
Mm-hmm.
Wow. Because I always feel like Canada or BC is pretty strict on a lot of these things. But it's like the schools ask, I think, for a vaccination record, but it's not like you can't go. So that's extremely...
You can't go. Are you sure? I'm pretty sure Canada's just as strict.
Really?
I think you need it. Yeah.
Well, I homeschool, so and it's not because of that. So that's interesting. I'll have to look into that.
Yeah, like in Illinois, there's been legislation put forth even to try to consider homeschools a type of private school so that they are under requirements. Like, what? Like, you guys are insane.
I don't know. I wouldn't be shocked if something like that goes around in California, but then I don't know what would happen, because then you would actually be forcing it completely. Because there would be no options, because you are forced to go to school.
Yes.
That's also a law. So I don't know. I mean, I would be very interested to see that actually happen, because I think that would make for some very interesting legal battles. You know, for right now, you still have the ability to homeschool, so you can't say that you're forced to do it. You know, what everything would happen with COVID, you know, like there were a lot of legal battles that pushed back. Hasn't exactly happened for regular shots yet. I think it's coming at some point, but we'll see.
Yeah. That's my last sort of question for you. With COVID, I know there was a lot of anxiety. There was a lot of depression and stress on children. And I know you said that you did see the ramifications within your practice. But my question with that is, did you see a difference in parenting styles impacting that? I know I personally did, just with people I know, but I'm wondering if you did.
Yeah, I think the families that were a little bit more, I don't know, like laid back about it, and we're like, okay, well, it's a virus, and you know, we're going to keep our bodies healthy as we can, and you know, just like any other disease, we should be fine. And they kind of looked at the actual data, especially for kids, and there wasn't a huge risk for kids. Then those families seem to kind of just go about their business and go along their day. And then the ones that were super scared of everything, you know, their kids had that stress put onto them as well. Because obviously, if you're like 5 years old and you're like, think you're going to kill grandma, then that's going to affect you. So yeah, I think like anything, the way that you act impacts your kids, and certainly during COVID, the way that families kind of responded and lived through that, and I'm sure talked about at home and what they did, and how they lived their life, and you know, going out versus not going out, and doing things versus not doing things. Like the more that you were at home and sedentary and kind of just in your own little very small bubble and not around other people, I think that obviously increased stress for everybody. So yeah, I think that, I mean, obviously it affected everybody. It was an interesting time where we did all the opposite things we should do for our health during a disease, which was weird, but we did. And hopefully we learned some things.
Okay, not to bring it back to, I had to look up, are vaccines required to attend school? And so I don't know about every province, but in BC, you're required to submit the immunization record, but you don't need to be fully immunized. But if there's an outbreak of a certain condition, unvaccinated children might be asked to stay home. So, but it does include even homeschooled children need to have their immunization record sent in, which I don't know that I've ever done that. I don't think I have. So that's very interesting to me.
Or you did send it in, definitely.
Yeah. If anyone's listening, I definitely did send it in. Anyway, okay. So your book, Parenting at Your Child's Pace, can you give us like just a rundown of some of like, you know, the main topics that you hit in that? Like, I love that title. And maybe it's also as a homeschooler, like as I've been homeschooling over the years, something that I've really learned to do is not to just force the kids along at like, oh, this is what you're supposed to be doing in this grade. And, you know, it really, you do learn that going at your child's pace is the best way for them to learn and grow. And it's also best for your sanity. So I love the title of your book and would just love to hear, like, what are some of the main things that you hit on there?
So the big two themes in the book are decreasing stress for parents. So kind of running through all the big topics, all the questions that I get every single day, and trying to help parents synthesize that information through the evidence that's out there and also the different perspectives. So that way parents can make decisions that they feel comfortable. So that's one big part of it. And I kind of run through the ages. So the newborn stage and toddler stage, and, you know, the big questions of potty training and feeding and all these things, but just maybe from a little bit different perspective, from a pediatrician perspective, because most of those books and most of those discussions come from a therapist these days. It's like that's who's written most of the parenting books, I feel like, or moms, but you know, a lot of therapists, and they're great, but just different perspective than a pediatrician. So you get that and kind of that things that I've seen. So that's one big part, and then the second big part is health. there's really no other parenting books that talk about health because, again, most of them are not written by doctors. And I think that's super important with where we're going with chronic disease. And so really the first chapter talks about the foundations of health and setting the stage for health for our kids. And so I think that's a very unique part of this book, especially for an integrative minded parent. I think that's really targeting, people that would probably listen to you guys. Because if you're like more integrated minded, then this book doesn't take one side. It talks about everything. It doesn't force anything. It just discusses the things that are going to be coming your way and then helps you to make those decisions, or at least to be aware of what's coming. So that way you can think about it and research it more and discuss it. Because I know what people ask me every single day. It wasn't hard to write this book because it was just like, okay, what do I get asked every day? And then just go through that.
Yeah.
That sounds awesome.
Well, I appreciate you coming on. I don't know if you have any other questions, Cecily, but I just enjoyed this conversation.
Me too.
I feel like I could talk to you about this stuff for a very long time and just not run out of things to discuss.
And like you said, as you were explaining that your book there, this conversation, and it sounds like your book really would be a great fit for our audience, because I really think those are the kind of people that we have here that just kind of want to see all the information. And actually, when you were talking earlier about what force is, like, Rita, I knew that you would love that part of the conversation when he was talking about, like, are you really forced to do something?
Yeah.
Or are you just not willing to choose another option? I'm like, oh my goodness, Rita's going to love that, because we've talked about that a lot. Like, are you truly being forced into doing something, or are you just not wanting to make the other decision, So that was really good. And I think our listeners are those people who are ready to look at all the options and make the best decisions for their families. So your book sounds like an incredible resource, and I know they'll enjoy this conversation as well. So thank you for your time.
Well, thank you for having me on.
Maybe you should tell people, because we've talked about your Instagram a lot, tell them your handle and how they can find you, because it's a great account to follow.
Yeah. So Instagram or X, it's at Dr. Joel Gator. And then the book is Parenting at Your Child's Pace. And you can get it, Amazon, all the places, or parentingatyourchildspace.com.
Awesome. Okay. Well, thank you for joining us.
Thanks for having me.
All right. So a huge thank you to Dr. Gator. What a great interview. I really appreciate the way he thinks through things and the way he communicates information. I think that's a huge gift to parents. So those who are patients at his clinic, I think they've really received a gift. And I'm glad that he takes his whiteboard all over social media and just says things that make you go, that's right. I think that's awesome when people are willing to do things like that. So thank you, Dr. Gator. You guys, thank you for listening. Please don't forget, if you haven't done it yet, rate, review, subscribe, follow, whatever the language is on your podcast app that you use to listen. Follow us there. Also engage on Instagram. These are all ways that are totally free that you can support the podcast. And it really means a lot to us. It helps us grow. And we love the work that we get to do. And that's one way that you can help us out. So please go ahead and do that. And if you want to follow us outside the podcast, you can always find us on Instagram at BOOMCLAP Podcast, or individually, I'm on Instagram at cecily.dickey, or my website, thegracetogrow.com.
And you can find me at ritarogersco.com or Rita Rogers Co on Instagram. Thanks for listening.